The information presented in this program is designed to be an educational aid only. It is not intended to replace the advice and care of your doctor, nor is it intended to be used for medical diagnosis or treatment.
Welcome to the Dr. Paul Child Health and Wellness Program. I'm Cindy Aikman. This is Dr. Paul. Can you tell us a little bit about yourself?
Sure. I'm a pediatrician, and you're asking yourself, what's he doing on TV? Well, I like to use TV and other media to educate parents. I believe that education is very important when it comes to your child's health and wellness. And it stems from my background in that before I became a doctor, I was actually a TV and radio producer.
What exactly is pediatrics?
That's a good question. Technically, pediatrics means you're a doctor studying the disease of children. But it's more than that. It's not studying the disease of children. It's actually studying the growth and development of children. You see, when a child is born, he or she grows from a 7 to 10-pound baby to a 1-year-old who's walking and talking. And there's a lot that's going on. So basically, pediatrics is looking at how well a child develops, how well a child grows, and also importantly, it's also education in teaching parents. It's also a challenge being a pediatrician in that when you're looking at a child, for example, a newborn, the child doesn't speak to you. You're asking the parents questions. What's going on? What's the history? And you're getting it from a second party. So I call it medicine by proxy. In other words, you're using somebody else, a third party, to give you the message. Same way as when you're giving a treatment to a child. At that point, the child you're not giving to the child's going to be given the treatment from the parents. So the parents need to understand. So that's why, in my mind, pediatrics is also health education and prevention.
I know you're a fan of the concept, knowledge is comfort.
Yes. Knowledge is comfort is a term that I coined a couple of years ago, in that what happens? You have a child, you've got a newborn child at home, you're worried about is this normal, is that normal, is that normal? And the more you read about, the more you learn about what's normal or not, the more comfortable you'll be with your child. So indeed, when it comes to your child health and wellness, knowledge is indeed comfort.
As parents, we have many concerns and questions for our child's doctor. How do you know you've chosen the right doctor for you?
Well, first of all, a pediatrician is a specialist who has gone to school for 4 extra years in what we call a residency after medical school to study childhood illness and development. And that is important. So basically the qualifications are important. In the United States, American Board Certified, it tells you that this person has studied and has passed all the qualifying exams and is competent enough and is certified. But there's more to that. There's also the personality. I think you're going to be going into a long-term relationship with your doctor, especially when you have a new child, because you're going to be wanting to meet him or her before the child is born, get to know him or her, and then be comfortable with that person, because you're going to have a lot of questions about your child's health, about is the child well, is this normal, is that abnormal? And if you're not comfortable from the beginning with this person, then you've got a problem. So I suggest you spend a lot of time trying to find a proper pediatrician or doctor for your child. Now, that can come from calling up societies, calling up the American Board of Pediatrics, getting a recommendation there, getting a recommendation from a friend or a relative. Word of mouth is actually a good way of doing it as well.
So you found your doctor. Now, how often should you be going for checkups?
Checkups are important, and they should be done initially every couple of months. Actually, the first checkup should be done within the first month of life. After that, it's in the 2nd, 4th, 6th month, 8 months, and 12 months. It's usually every couple of months. As a child gets older, it could be less frequently. And by the time a child is 3 or 4 years of age, we recommend to do it every year or so. Obviously, if the child is unwell in between, you're going to visit the doctor as well.
Now, pediatrician plays the role of medical support and also resource of information. But what exactly is the role of a pediatrician in a child's life?
The role of the pediatrician, I think, there's several roles, first of all. Number one, to make sure the child is growing and developing normally, and to be able to identify when that's not happening and do something about it. Number two, to be able to help the parents, especially when the child is ill, to be available. And number three, to be able to be a resource for the parents. The parents may require some additional information. A pediatrician can help you. There are a lot of booklets or a lot of videos out there that the pediatrician would know. His or her office may have these things. So the pediatrician is a very valuable resource to you and is an ally for taking care of your child with you.
Pediatrics covers children of what ages?
Technically, pediatrics really looks at children from 0 to 18 years of age. And there's a lot of subspecialties as well. For example, premature babies run under pediatrics, so you kind of call it -1 or -2 months of age. That runs under pediatrics. And adolescent medicine is also now a subspecialty of pediatrics because we recognize that adolescents have their own needs and concerns as well.
Still ahead on the Dr. Paul Child Health and Wellness Program, protecting your child with immunizations.